Hi everyone. I want to briefly talk about a situation that the parents of a newborn baby could be faced with, which is bleeding umbilicus. Bleeding umbilicus. It is called hemorrhagic disease of the newborn in the past. It is now called Vitamin K Deficiency Bleeding. Okay, let's go. Hemorrhagic disease of the newborn or Vitamin K Deficiency Bleeding will present in a newborn with bleeding umbilicus, or the bleeding can be in other parts of the body as well. And that is why we have to rule out other differentials and determine if this child is stable or not. The possible differentials there could be bleeding dyscrasia, and we have a lot of them, liver pathology, but commonly vitamin K deficiency. And the possible brief investigations we can do can include complete blood count, liver function tests involving INR and PTT, ultrasound, CT or MRI to be able to rule out possible intracranial hemorrhage. Like I said, it is now called vitamin K deficiency bleeding, and the pathology is essentially that of a sterile gut that will have low level of vitamin K because there are no bacteria to help in the production of vitamin K. Then poor placenta transfer of vitamin K from the mother. So they are not inheriting that. And decreased vitamin K in breast milk. We are encouraging exclusive breastfeeding, but there is decreased vitamin K in that breast milk. And immature liver that will not be able to utilize even the vitamin K efficiently. And maternal coumarin-like anticoagulant use. And that is why we don't give warfarin, not only because of this, but other reasons in pregnancy. And anticoagulants and cephalosporin usage by the mother while pregnant. Clinical features will include bruises, ecchymosis, and I'm going to lay emphasis on bleeding from the umbilicus because that is what most mothers and even fathers sometimes will be concerned about, because while cleaning the newborn, they will see that the umbilicus stump is bleeding, blood is oozing out. Some, if it is massive, could be ecchymosis, bruises, and even intracranial hemorrhage with possible neurological symptoms. And it starts as early as first day of life. Majority will start at first to the fourth week of life. But it is possible that the onset could be delayed for up to the third week of life, even to the 8th month of life. How could we prevent this? So easy. Vitamin K prophylaxis at birth, 0.5 to 1 milligram given intramuscularly. And to those mothers who are breastfeeding, particularly those who are breastfeeding exclusively, the infant should have mother supplemented with vitamin K. The treatment is vitamin K intravenously or subcutaneously at the rate of 1 to 2 milligrams. There will be obvious results within 2 to 3 hours. And if you are not winning, you can use fresh frozen plasma. In conclusion, it may be a mild case like we've just gone through, but it might be a serious condition. All you need to do is early presentation, and that will help a lot. Thanks for listening to my presentation. Kindly subscribe so that I can get these presentations immediately they are published. Thank you.